What if your knee pain is actually coming from your hip? Let's break it down.
Using Thomas test, special test in order to see the tightness of the hip flexor. A lot of the times, all you have to do is load it. You would think tight muscles, you have to stretch, 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 stretch. But a lot of times, it's really just loading it and getting it stronger. But if that's limited, it's going to cause imbalances in the pelvis. You're not going to be able to get as much hip extension, and it can help lead to weak glutes as well because that hip flexor is firing so much and it's so tight. So another thing for the hips is definitely the strength of the hips, particularly the gluteus medius, which plays a role in the valgus knee positioning. That valgus is when that knee is, diving inwards towards the midline of your body. If you're able to strengthen up that hip and get that knee to align, track over your toes more, you should be able to see at least the big toe on the inside of your knee when when that knee is bending or you're going like into a squatting position. So ensuring, that the hip mechanics, are in line with the knee and in line with the ankle and foot is very important because then, every step that you're taking, you're just putting more pressure on the ligaments on the inside and also putting more pressure on the lateral side, the compression. We do notice a lot of times when we get mobilization into the hip, whether it's an anterior glide, lateral glide, inferior glide, that loosens up the hip and lets them get more mobility. Then you got to strengthen in those ranges that you just gained, and then you'll notice that it's going to start sticking. Once that sticks, you're able to walk better. You're taking a lot of pressure off of that knee day through day, thousands of steps a day. It's going to add up and accumulate and lead to problems in the long term.